Now we are going to discuss about physical therapy management of the Parkinson's patient. Number 1 is the amplitude training, number 2 is the reciprocal patterns, number 3 balance work, number 4 stretching and the flexibility exercises, number 5 strength training, number 6 locomotor training, and the number 7 gait training. Here you can see in this picture exercise for the Parkinson's disease. These are the general exercises. In early stages, we can recommend the patient to chair squats, brisk walking, and the jogging. In middle stages, we can recommend the patient bridging exercises and the dancing exercises. And in the advanced stage, we can recommend the patients to clamshell exercises and the heel lift exercises. Now we discuss one by one. LSVT BIG training is the Lee Silverman voice training. It is a physical and the occupational therapy program. Today we do get experience some other exercises. These are LSVT BIG training exercises, 1 hour individual session, 4 days a week for the 4 weeks, include daily home practice. Here is the 3 types of the LSVT BIG training is the sustained movements, the directional repetitive movements, then for the functional exercises. Number 1 is the sustained. In this LSVT BIG training, we use sturdy chair with no arms. Here you can see in this picture. Here is the sturdy chair with no arms. The patient is sit edge of the chair. Then number 1 is the floor to ceiling, big arm forward, then big reach and hold this position. Then is the side to side, forward step and the reach, sideways step and the reach, backward step and the reach, forward rock and the reach, sideways rock and the reach. These are all the exercises which is used in the LSVT BIG training. Then is the directional repetitive movement, forward step, sideways step and the backward step. Forward step, forward with the big arm, out to side, then step right back to original position 4 times in the right side, then move to the left side. Then is the sideways step, big step out and then back, and the backward step, big arm in front, then take back step and big step back, reach back. Then functional exercises, sit to stand exercises, sit, big reach forward, then come up, big stand, the big arms back and then reach forward and back to sit. These are all the LSVT BIG training exercises. Then is the reciprocal pattern. LSVT BIG training is over exaggerated physical movements like high steps and the arm swing. It's a way to retain the muscles and slow down the progression of the hypokinesia, the increasing smaller, more shuffling movements that happen with the Parkinson's patient. Then here is the reciprocal pattern. Reciprocal movements are side to side and left to right. Reciprocal patterns are side to side and left to right patterns, such as swinging your arms while taking step as walk. Parkinson's disease can have affect these patterns. So reinforce reciprocal patterns by the use of the recumbent bicycle, a stationary bike in which the patient sit in an inclined position, or elliptical machine in which patients use their arms and the legs. So here you can see in this picture, reciprocal pattern means if the one leg is moved forward, then the opposite upper limb swing. Here you can see in this picture, if the patient is unable to walk, then we can do the exercises in the sitting position. Like patient is sit on the chair, back fully supported, feet flat on the chair, feet flat on the floor, move forward means shoulder forward flexed, extend the elbow and wrist is also extended, then extend the shoulder. Then is the balance work for the balance, for improve the balance, normal balance, interplay among what the patient see, their inner ear and how their feet sense the ground beneath them. Parkinson's disease can affect this balance system, making the gait unstable, which in turn may make the patient fearful to be in the public and the crowded places. Gait training, like practice walking, can help. Exercise that aim to improve balance should be guided by the physical therapist, who can work with the patient to understand any issue with the balance and reach the ways to compensate. So here is the some exercises for people with the Parkinson's disease, balance exercises. Now here you can see in this picture is the static standing balance. It is one of the best balancing exercise for the Parkinson's patient. Stand along with your feet together, keep your body upright, hold for the 30 seconds. Then second one is the tandem walking. Tandem walking, now stand with the one foot ahead of the opposite, so the heel and the toe are in the line. Keep the body upright and maintain the balance. Try to look straight ahead. Hold for the 30 seconds. Repeat with the opposite foot ahead. Progress this exercise into a dynamic one. Then is the wall leans. Another best exercise for the Parkinson's patient. Stand with the back against the wall with your feet far away. Pull body from the wall using your leg strength until the body is upright. Slowly move your hips backward until it touches the wall. Once more, then move the higher body to touching the wall. The toes ought to carry up slightly throughout the movement. Repeat 10 times. Move on to a series of the dynamic balance exercises that involve maintaining the balance while moving your feet. Then is the tandem walking. It is just like the tandem standing. In tandem standing, the patient can in the standing position, but in the tandem walk, patient can walk. Choose a sport sooner, then focus on it to stay steady as you walk by placing your heels simply before the toes of your alternative foot. Repeat for 20 steps. Then is the single leg stand. Single leg stand, raise one leg, so balancing on the opposite side. Hold for the 10 seconds. Repeat with the alternative leg. Then is the side stepping. Take a step sideways with one leg followed by the opposite leg. Continue walking sideways for the 10 steps. Repeat in the alternative direction. Then is the lateral weight shift. Lateral weight shift is we can recommend the patient in the sitting position, also in the standing position. If patient is unable to stand, then we can recommend the patient in the sitting position. Lateral weight shift, stand with the feet shoulder breadth apart. Gradually shift the weight to the right as far as possible without taking a step. Come back to the beginner position. Repeat the same process to the left side. Hold every position for the 3 seconds. Repeat 10 times. Then we can also add dual tasking. It is another best balancing exercise for Parkinson's disease. Practice walking for 2 minutes while performing different tasks, like motor tasks such as holding a cup of tea, cognitive tasks such as the subtracting a random number by 3, naming objects like animals, colors, holding a conversation with another person. For dual tasking, primary attention should be on balancing and the walking, with all other activities as secondary tasks. Now here is the stretching and the flexibility exercises. It's common for the patient with the Parkinson's disease to develop tight hip flexors, hamstrings, calf muscles and all other muscles in the body. To counteract that stiffness, it's best to stretch at frequent intervals throughout the day. Here is some stretching exercises you can see in this picture. Neck stretch, head rotation, back stretch, chest stretch, calf stretch, wrist stretch, forearm stretch, shoulder extensor stretch. These are all the stretching exercises which is useful for enhance the flexibility of the Parkinson's patient. Then is the strength training. Muscles naturally weaken with the age, so strength training is important for everyone, but research suggests that muscle weakness is a bigger problem for the patient with the Parkinson's disease. So depending on what stage of the disease the patient are in, therapist might have do resistance exercises for strengthen the muscle, like light dumbbells or a resistance band, a kind of thick rubber band. Pool based classes using the water resistance to strengthen the muscles can also be a good fit. Then here is the locomotor training for improving the locomotion of the Parkinson's patient. Lengthen stride length, broaden base of spot, because when we base of spot broaden, then the falling chances of the falling is decreased. Improve heel to gait pattern, increased speed, increased trunk rotation and arm swing. These are all the locomotor training which is used in the Parkinson's patient's rehabilitation. And next is the gait training. Gait training is very important for the patient because the gait is also disturbed in the Parkinson's disease. Here is some exercises which is used for the gait training program. Here you can see in this picture the patient is in the cat posture, and then we ask the patient to reach the chair, and with the help of the chair you can sit in the chair. Then here is the assistance for standing. Then without assistance the patient stand. Then when the patient stand without assistance, then we can add different tasks like knee bending. Then mark on the floor and ask the patient to walk in these two lines. Then sideways walks on the marks. Then increase the stride length according to the capacity of the patient. Then mark the floor and ask the patient. और हम ये कह सकते हैं कि हम ज़मीन पे जो है उसके फ्लोर के ऊपर हम डिफरेंट मार्क्स लगा देते हैं एंड फिर हम पेशेंट से कहते हैं कि इन मार्क्स के ऊपर इस वाले कलर के ऊपर पाँव रखें या इस वाले कलर के ऊपर पाँव रखें, ठीक है. देन वी कैन ऐड डिफरेंट ऑब्स्टेकल्स इन द वॉकिंग. देन वी यूज़ 2 sticks in which the patient and the partner जो है दोनों उसको पकड़ के रखेंगे, which is used for the swinging of the arm improved because the arm swinging is decreased in the Parkinson's patients. Then at the end we use treadmill training. Treadmill training is very important for the Parkinson's patient and it is very beneficial for this patient. Then it is a case study. The patient is A, gender male, age was the 60, occupational carpenter, presenting complaint uncontrolled or the involuntary movements of the hands. Then there are some stiffness, decreased range of motion, bradykinesia, slowness of movement, loss of activity of the daily livings. History of activity of daily livings, history of present illness. The patient is presented with the usual state of health. He is presented with involuntary shaking movements of the limbs. Then past medical history is the hypertension and patient is suffering from the high cholesterol level. No surgical history. Drug history, Extor, patient is taking Extor for the hypertension and levodopa for the Parkinson. The family history, his wife is suffering from the Alzheimer disease. Then investigation is the MRI. PT management is the aerobic exercises. In aerobic exercises we can recommend the patients to for brisk walking, jogging exercises, strength training exercises, use dumbbells and different resistance exercises, balance exercises and the coordination exercises. In coordination exercises, we recommend the patient traditional and the stationary bicycle, swimming, water aerobics, standing behind a chair, resistance one leg and moving it forward. These are all for the coordination and the coordination. Balance and core training both help improve gait. Walking is full body task that requires coordinated movement from the feet, legs and the core. With the balance and the core training, you can improve your stability while walking and reduce the risk falling. Then brain boosting exercises in which we recommend the patient singing, word searches, playing card games. These are all the brain boosting exercises. Thank you.